So, hi, I'm Tiffany Fennell, Chair of the Veterans Affairs section of Division 18, and I'd like to welcome everyone to today's webinar titled Pursuing Board Certification as a Professional Psychologist, the Clinical Psychology Perspective, presented by Dr. Ed Neuhaus. This webinar is sponsored by the VA section of APA Division 18, Psychologists and Public Service. Division 18 is considered the home division for VA psychologists in APA, as well as for other public service psychologists, like those in community and state hospitals, Indian country, criminal justice, and police and public safety. For more information about Division 18 and the VA section, please check out the Files and Web Links pods for a brochure and links to our website, Twitter, and Facebook page. And you'll also find a copy of today's slides in the Files pod that you can download for reference. All questions can be entered into the chat box below. And Dr. Neuhaus will respond to questions as we go, and there will be time to also left towards the end to respond to any questions. And if there are any technical difficulties, please let me know in the chat field, and I'll attend to you as quickly as possible. So now to present our speaker. So our presenter today, Dr. Ed Neuhaus, has been affiliated with Harvard Medical School, McLean Hospital, where he holds academic and clinical appointments. He served as co-director of the predoctoral psychology internship program from 1996 to 2009, clinical director of the adult partial hospitalization program services, and led treatment outcome research. Currently, he oversees clinical care for a national network of community mental health centers with an emphasis on outcomes measurements and using data analytics to inform best practices and improve quality of care. And Dr. Neuhaus is also joined today by Dr. Leo Caraballo, his colleague at the American Board of Professional Psychology, who serves on the Board of Trustees as the Early Career Psychologist representative. You may recall the webinars that he offered our members this past summer. Until recently, Dr. Carballo served veterans at the Phoenix VA. He's now at Walter Reed National Military Medical Center. So I want to thank both of you for joining us today and being willing to present on this really important topic. And so now I'll turn it over to Dr. Neuhaus.
Thank you, Tiffany. Hi, everyone. Delighted to be here, talk about clinical psychology and what we're doing on the board and how to, what the steps are and really the substance of pursuing board certification from the clinical psychology perspective. So just to give you an overview of what I'll be talking about today, I'll talk about why board certification and why clinical psychology in particular, the eligibility requirements, the application and candidacy process, and then go down into more detail about the actual evaluation criteria for clinical psychology. I'll go over the competency domains, which are really the criteria that are used to evaluate the practice sample, which is your professional statement. There's a structure to the professional statement, and I'll get into the details of that, as well as there are video work samples. So if you think of this in the big picture, you provide your professional statement, there are video work samples, and then you are evaluated by the board, a committee, on specific competency domains so that we see that from a clinical psychology perspective, candidates are meeting all of those standards. There is a senior psychologist option, which really means that because people have had a number of years of experience, over 15 years or more experience, that there are some exceptions in terms of how you submit and what you submit in your application. And then I'll go over kind of a high level of some screenshots of the website of how you navigate it and get to the places that you need to get to. Okay, so our two main objectives today are really understanding and for you to understand the foundational and functional core competencies for board certification in clinical psychology, and for you to understand the application process to become a candidate and the specific steps leading to becoming board certified. So why get board certified? That's a question many people ask, why spend the time, why bother? First and foremost, it's a demonstration of formal recognition to your peers and to the public that you have attained specialty level practice in clinical psychology, that you have identified you've met all the standards, gone through the rigors of that uh, to become board certified. It also shows your dedication to lifelong learning and professional development. And in some cases, it may improve your position for promotion and possibly for a salary increase. That may be possible. Uh, so something to take into account. And that it can facilitate licensure mobility and ease of the credentialing process. There are many details if you're moving from state to state, and the abap.org website has a section on the reciprocity and mobility rather than going into that in detail because there are a lot of details in that. But suffice to say that there are resources to help you see, you know, what board certification can do to help facilitate that. Okay. So let's start with the definition of clinical psychology as a specialty, because there are a number of specialties in professional psychology on the ABAP website. You'll go there. There are a number of specialties, and I know not everyone on this webinar is a clinical psychologist per se, but there are elements of clinical psychology that are unique to it. So, first and foremost, it's both a general practice and a health service provider specialty. And if you look at what clinical psychologists do, the specifics, identifying clinical psychologists as clinical psychologists is providing professional services for the diagnosis, assessment, evaluation, treatment, and prevention of many disorders, psychological, emotional, psychophysiological behaviors across the lifespan. So it's not tied to a particular age group, but it's across the lifespan. And the services, there's an aspect of really understanding, predicting, and alleviating a wide range of distress, as well as for social and behavioral maladjustment and mental illness, so that there is a kind of that psychiatric psychopathology component as well as just general distress, other forms of discomfort. As well as, if you say it includes the enhancement, so you're identifying the problems, diagnosing, assessing, formulating, conceptualizing problems, and looking at ways of enhancing functioning in the identified areas. And then last, but certainly not least, this is a very important thing, especially uh, in your application, that it's for people who provide services directly, as well as support or facilitate the provision of the services. So that may be as a supervisor doing teaching, management, administration, as well as advocacy. So you have the basic requirements, you know what the clinical psychologist framework is at a very high level. Then there are the specific eligibility requirements. So I'm going to take the 30,000-foot view here of the absolute essentials, doctoral degree, Ph.D. or Ph.D. in clinical professional psychology from an accredited program. You have to submit transcripts to verify that. Uh, you've completed an APA or CPA accredited internship, APIC approved. And then for postdoctoral experience, so it's 2 years of experience working consistent with what would be considered clinical psychology with at least 1 year supervised, or, so it's an either or, you complete a 1 year formal postdoctoral training program in clinical psychology. So if you think, get your doctorate, internship, and postdoctoral experience, and then it down to licensure where you're independently licensed or certified in your jurisdiction in compliance with all state or provincial board regulations. There are more details to this. This slide probably, if I took from the manual, would go to, at least one full page or a couple of pages in the manual. The manual is very useful resource for everyone. It has all the details and specifics easily downloaded from the website. And it goes over the real specific eligibility requirements if you have a specific question on that or you're not really clear. I mean, if anyone has questions today, we can certainly answer them as best we can. But if we can't, we'll direct you there. And if that's not answering your question, I'll make sure that you get an answer. Okay, so let's then take the application candidacy process. So I've taken a process with many steps, put it in basically three buckets. So there's a process of you submitting the application. So there's work that the candidate is doing and that the board is doing to it's like the screening of your application, right? So submitting the practice sample review is we have all the materials and we're going into detail about that. And then there's the oral exam and board certification. So let's just look at the submitting the application. So you go to the ABAP website. There's a part on the left navigation bar, the specialty pages. You select clinical psychology. You get all the information, including the manual and all the elements uh, of the application. You submit the practice sample. So so if you think of application and practice sample, those are synonymous. So you submit all those materials, pay the fees. So there are fees that are paid at each step of the way. So that you submit your practice sample. Then there's a screening process. So this goes back to the eligibility. Before the details of your practice sample are reviewed, there needs to be a verification of your eligibility that you met the criteria of, doctoral, you have a doctorate, internship, postdoctoral requirements, licensure. And then there's an exam committee at the American Board of Clinical Psychology that's convened. There are three members, one of whom is a chair, who is assigned to review the practice sample. So then we go to this section. So the middle section, the practice sample review. So that combines your CV, have your CV there, included. The professional statement has a number of questions. I'll get to that at the end. I'll kind of show you the breakdown of each element of the professional statement. There are the video samples, or if the senior psychologist, there's no video, but there's a portfolio instead. And that your professional statement and the video samples or the portfolio are evaluated according to the criteria of the core competencies. And I say rating grid form F, that is in the manual. It lists all of the core competencies, operationalizes them for you, so you really see, how a clinical psychology candidate is being evaluated, and as a candidate prepares their practice sample, to be sensitive to that, to make sure that you are connecting the dots, because we're going to be trying to connect the dots as well. And for a pass, it's 2 of 3 examiners. You have to pass in all competency domains. And then once that is determined, there's a pass. There's an oral exam that's scheduled, and you have to pay fees for the next step to get to the oral exam. If by chance the committee does not pass the candidate, there is a thorough review with very specific and detailed kind of reasons of where the areas of weakness are in the application, and in some way a pathway of how to go from where the candidate is now to becoming eligible based on what the evaluation was on the core competencies. But back to the pass. So you've passed, then you schedule your oral exam, and the oral exam is essentially like a 3.5 hour meeting. I view it as a collegial meeting. The candidate has met all the standards based on their paper, if you will, or digital material, and the oral exam is really to have a conversation about that, discussion, questions that the committee has that members want more detail about, and for the candidate to demonstrate their depth of knowledge and skills and attitudes really about their work and professional clinical psychology. And once again, the core competencies are assessed. It's that form F. So it's, you think of it, it's done in the paper review, and then it's done in the at the oral exam. And again, it's the same thing with passing. 2 of 3 examiners pass, and then once passed, there's approval for board certification. And in that process, or as a result of that process, candidates earn 40 hours of CE credits. This was something was discussed in recent years, and how much time and effort candidates spend. It really made sense that people would be given CE credits, given that it is a really time and effort for one's own professional development at the minimum. So now I want to go down to the next level of detail and go over the competency domains. So these are really the competency areas that we are defining as the clinical psychology competency domains. Now, no doubt there are overlaps with other specialty areas, but as a set of core competencies, this is what the American Board of Clinical Psychology is defining as the core competencies. So we have 2 general areas, foundational and functional competencies. The third, the functional, is an optional aspect, so I'll get into the nuances of that. But if you think of the foundational, let's see. Oh, here we go. Sorry, I was pressing my laptop button and not the one here. So the foundational, we have 8 foundational core competencies. So relationships, individual cultural diversity, ethical and legal, professionalism, reflective practice and self-assessment, interdisciplinary systems, and then the last 2, science, knowledge, and methods, along with evidence-based practice. So you think of this as a clinical psychologist, these are the areas and domain knowledge base, if you will, practice, how one carries oneself. That's that bucket. And then the functional is really how that then is, or what's translated into the actual delivery of services in some way, shape, or form. So assessment, diagnosis, conceptualization, those all go together. Excuse me. There's intervention and consultation. Please don't forget consultation. For some reason, we have found over the years that candidates don't include consultation, and we've made efforts for communication and reframing language in the manual to really highlight what it is and why it's important. And then we have the functional optional. So this is when we say optional, it may not be optional for you, but in terms of the criteria for evaluating candidates, most candidates have at least one optional functional competency that's included, but we're not saying that it's required. So research, supervision, teaching, management, administration, and advocacy. So the next few slides, I'm going to show you in detail. I'm not going to read everything that's on the slide. I don't want to, put everyone to sleep. I mean, you'll be able to see it, and you'll have this to be able to refer to, and certainly in the manual that these are really fleshed out in detail. But I thought it would be good to just give you a feel of like really what we're talking
Dr.
about.
Neuhaus, before you continue, there's a question in the chat
Yes. Yep.
box from Monica
Okay.
saying, once you've met the basic eligibility requirements, is there a certain amount of time you need to be in an independent practice before you can apply? I've been in early entry programs since grad school and independent practice since July 2017, licensed. Can I apply?
It's 2 years. Is that
Yes, that
correct,
is
Leo?
correct. So if you did a APIC or APA postdoc in clinical psychology, it reduces it to the moment of licensure. But if you did not do a formal postdoc in clinical psychology, it's 2 years post-licensure.
Okay, I see typing. If there's a, okay, you're welcome. All right, so let's go to the next slide. So what this is, I'm going to go through each of the competency areas just to provide you with a little description of what's called a behavioral anchor. So these are as objective as criteria as we can get that help obviously the examiners evaluate and kind of with inter-rater reliability and for candidates to know, okay, this is what they're talking about regarding relationships. And when you are constructing and crafting your practice sample, these are the things that you need to be paying attention to. So from a relationship standpoint, this is a field of forming relationships with people, and that there's, you know, in how you present yourself, that you're presenting that there's a sensitivity to the welfare rights of others, as well as, really showing an understanding of managing diverse views, could be conflict negotiation, clear communication, how you have an impact on other people. From the individual and cultural diversity area, demonstrating knowledge, sensitivity, working with a wide range of individuals and groups of all aspects of individual and cultural diversity, race, gender, age, sexual orientation, disability, and special populations, and showing an awareness of your own characteristics and their influence on like how you are interacting with people or forming relationships or providing treatment and services. On the ethical and legal side, there is a section around presenting an ethical dilemma, but it's not limited to that. There may be areas you may be in a leadership position or in a clinical situation, and there's some ethical legal component that is part of what you want to talk about, and that you can convey that and articulate that in your application. And then professionalism, if you think of how do you present yourself as a professional? Do the rules of the game of how to present yourself to the public at large, or when you're representing yourself versus the agency or institution you work for, that there are things that you need to be aware of, and that's important of how that gets conveyed in your in the practice sample. Reflective self-practice, like how do we take care of ourselves? How are we thinking about what we're doing, our own self-development, self-care? I remember some years ago as a training director at McLean, and really and this goes back probably 20 years, but I think self-care was one of those things that, oh yeah, everybody was for it, but no one really highlighted it. And I think that when we made that a component of the internship that we wanted to highlight and check in with people, that certainly had a very positive response. And that should be, career long, lifelong, that we have to take care of ourselves. It's, we are, clinical psychologists, all psychologists in, serving consumers of all walks of life takes a toll on us. We have to make sure that we are at our best as well. Interdisciplinary systems, yes, I have a specialty as a psychologist, clinical psychologist, but the world isn't made up of only one specialty. There are many specialties, diverse uh, perspectives that don't always coincide or sync well, and you've got to convey in your uh, application how you manage that in your daily practice, giving an anecdote of how you work with others. It could be maybe you're supervising a resident, or you work with a physician or a nurse or someone if from another discipline, and how you manage that relationship, and hopefully can demonstrate how you can thrive in that in those situations. And then the last is science, knowledge, and methods, and evidence-based practice. They're related, but they're different in a sense. The science, knowledge, and methods, and conveying, what is your grounding as a clinical psychologist in the science, in the knowledge base, in the research, and your ability to convey that. I've often said that, it's some of the psychological phenomena that what many of us have learned in graduate school become imprinted. Like that's our point of reference. Very important, but depending on how many years you go, things get updated. there may be some foundational elements that are very important, but it doesn't mean what you learn in graduate school is all there is. And really to demonstrate that if you've been in your career, let's say 10 years, what has changed, or have you thought about that? Or if a senior psychologist, 15, 20 years, are they showing that they are current around the science and the knowledge base in clinical psychology? And then with evidence-based practice, really showing an understanding of what evidence-based practice is, what uh, theoretical or approaches that you use, and to really explicate, well, why do you use that? For whom? Why is that important? How do you do it? Are there exceptions? So when you give case examples, and that could be both in a video sample and that you have a write-up about it, or you're conveying something about assessment or intervention or consultation. How does evidence-based practice fit into that? And to be able to really tie, connect the dots on that. So we did the foundational competencies and now the functional. This in some way, if you look at the clinical psychology, the services, the clinical services that are provided. So assessment, diagnosis, and conceptualization. I know many people in the field have done, and do formal testing batteries, assessment batteries with formal testing instruments, but that's not the only way of assessment. Could be you are doing, mental status exam. Maybe you're using different, using a Beck depression inventory, a PHQ-9, whatever it might be, an MMPI. But then how do you articulate your understanding of that for maybe diagnosis, for case conceptualization that would lead to treatment planning? Kind of the real, kind of the nitty gritty assessment to conceptualization to formulation to treatment planning. And then the intervention. This goes, it's very much related to the evidence-based practice, but really giving evidence of how you use an evidence-based practice. So if you're presenting a video sample, with an intervention, maybe you're doing like trauma-focused CBT, and showing what it is, and then maybe do a write-up. Well, this is how I approached it. These are the high points of, in the protocol that I wanted to do with this particular patient, and so on. And then consultation. So consultation, there are evidence-based practices for consultation, which we're certainly encouraging people to have some evidence base to how they consult. At the same time, consultation requires a very methodical approach, understanding what is the problem, what's the consultation question, is the question being answered, how are you answering it, and to really highlight that. In some ways, this may be a big challenge for people earlier in their career. I mean, it's not only that, but earlier question from Monica about, okay, can we apply? So yes, you can apply, but you also have to say, okay, can I meet this? Have I done consultation? There are fewer opportunities maybe early in your career, but if you do have those opportunities, seize that moment. Really try to understand that and convey that. So it's not like you have to be the master clinician consultant, but how do you think about consultation? How do you present yourself? How can you work with others? Because I look at consultation, if someone's coming to me, I want them to feel smarter, or they have some other angle of how to approach whatever it is that they're stuck with or they need help with, to be able to move on with that, and really being able to articulate that in your application. And then the optional competencies, research and evaluation. People may be more in an academic setting doing research, really to demonstrate what you're doing, like how, everything from research design, analysis, interpretation, and then in a more clinical way, supervision. What is your approach to supervision? How do you work with supervisees? One of the things, it's like taking a developmental perspective of where is the supervisee in their own professional development. So if I'm working with someone who is a practicum student, I have a different approach than someone who comes to me for peer supervision. There are different different approaches, for example. And then teaching, really being able to demonstrate what your approach is with teaching and grounding it in a rigorous in a rigorous way. Management and administration. Any people, this tends to happen more mid-career or later career. People have been clinicians and then they get promoted or they want to move into management and administration. And then, of course, advocacy. Very, very important. It's last on the list, but certainly not least. It probably should be on the top of really publicly promoting change of institutions, community, or in society. How you convey that, what you might be involved in, maybe volunteering, or maybe that's actually part of a paid position that you have, but to be able to, convey that. So those are the competency areas. Now let's look at the actual practice sample that I've been referring to for the past 30 minutes. So when I said there's a structure to it, there are 9 sections. And though as you answer those 9 sections, kind of thinking about, well, how do those foundational competencies come through in your responses? So if you look at this, so this is 1, 2, 3, 4, the first 4 questions. So here's a general description of your professional work. Who are you? What do you want to convey about yourself? And that may, draw on 5, 6, 7, 8 competency areas potentially. But you want to say, who are you as a clinical psychologist candidate, pursuing board certification, and what is important to you? And this can be, what your values are, to what your approach is, to what's important, to where your own mission and vision are. And then you want to get down to a little more detail about the evidence that informs your practice. And this is where you can just look at the specific, competency domain. So it's scientific knowledge and evidence-based practice. Those are, numbers 7 and 8 in the foundational area, as well as in the functional competencies: assessment and intervention, consultation, and then if applicable, what's the empirical basis for supervision and teaching? What are your own activities, right? So here you're describing who you are, and then you're in thinking of how you can reference those core competencies to demonstrate who you are, your level of expertise and competence. A difficult or complex relationship or interaction in the professional setting. So if you think of, the core competencies, there's relationships, there's interdisciplinary systems, maybe there's an ethical issue. So, maybe you've had some difference of opinion with someone from a different discipline or someone from the same discipline, or there's a conflict and you have to figure out how to navigate that, explaining that in detail and really showing both also, you think of self-reflective, self-awareness, reflective practice. It's like, oh, well, what am I bringing to this complex situation? If it's, well, I really tried to get this other person to change what they are, to me, that doesn't really pass muster for an example here. There's something of, well, what do you have to do to change? Maybe helping someone else change and finding some resolution. For example, I'm not saying that's all there is, but just, kind of give you, a point of reference. And then here are the other 5, the last 5. So awareness of individual and cultural diversity. So it may be a patient, a consumer that you've treated, or maybe it's a colleague or some other situation that you can convey your awareness of cultural and individual diversity, and how that awareness had an impact on what you did, how you thought about it, how it changed you, how you worked to change someone else, so on and so forth. Then there's an ethical dilemma, that you have to give, your own personal example. It's not some abstract thing. It's something that's happened to you. Obviously, you have to de-identify information when you're, providing that, but there could be something that, was it a situation you observed? There's something with a colleague, there's something with a patient. You're not sure what you should have done or did. And then you, again, explicate how you identify what the problem was, what your approach is. Did you get other consultation, for example? I mean, just rule of thumb, Anything ethical, ask a colleague. Get someone else involved to get another perspective. Don't be alone with this. Very, very, very important. Methods, your own personal way of engaging in reflective self-practice, self-assessment. Maybe you've done your own psychotherapy and that's part of it. Well, how does that factor into it? How does it? But we also want to know in an ongoing way. Maybe you did that early in your career, haven't done that, but what do you do for your own self-care? Or, maybe there's peer supervision, there's collegiality, there are things you do to manage yourself and well-being, to be able to thrive more personally and professionally. Interdisciplinary collaboration. I'm sure at the VA there are many opportunities to collaborate with people of different disciplines. Again, think of what's in the competency domains that can help guide you around how you frame the situation or how you describe it. Like go into I said the rating grid form F and look at it. I mean, that operationalizes all of the competency domains. I gave a general description, but in the manual, it really goes in detail of what this is and the behavioral anchors and the specifics, and that can help you craft your own narrative. Whether it's for this question or any question, so that it gives you examples and anchor points for guiding you in preparing the best application for candidacy that you can. And then there's a verification that there's no ethical and legal action pending. So the video work samples, not easy. You have to go through things. You get permission, you have to get the site, you got to get the camera, but you need two 30 to 60-minute videos, and it's basically pick 2 of 4 areas. You can't do 2 of the same areas, so it's assessment, intervention, consultation, supervision. Has to be done within 6 months of submitting your practice sample, and right now it's saved on USB drives, so that it's easy for the committee to review these. They can have, and it's preferable to have some written statement about what is going on in the sample as a point of reference. I like having some description of what the story of the plot line is, what you're trying to accomplish, and then you look at it and it's like, okay, yeah, I'm able to hit these 5 points, whatever that might be. So, like I said, the source documents, and then there's the production aspect. We weren't trained as video producers, but at this point, you just got to make sure it's a good video and audio. In some way, it's higher quality audio is very important, because if it's garbled, it's hard to tell. But you just want to get the video and the audio. No identifiers. Sometimes you're doing your best and it's like, oh, I forgot to take my badge off or something. And we those things happen. But you just want to give you some hints. And we're hoping soon that these samples, instead of the USB, can get uploaded directly to the website. We're working on the functionality for that. We're not quite there yet, but that's the plan. Okay, and the senior psychologist option. So you have to meet all the degree requirements. So everything is the same except with the video sample. So instead of the video sample, we say, okay, you've done this in the field, and if you can demonstrate through a portfolio of work, maybe you've written a book or books or many articles, research articles, or peer-reviewed papers, or you're on the road and you're giving presentations, or you're an expert in a particular area over time, and that you can use that as your portfolio. But if not, if you don't have that, then you can still do the standard way, that if you've got fewer than 15 years, you just go through the same thing. So this just gives the synopsis. So submitting the application, you're preparing, as I just described, the work that you have to do. This is a lot of work. There's no question about it. But to me, it's very satisfying, that this is self-reflect, you're kind of doing a self-reflection on your education and your career. Like, And I think most people are like, wow, like I've done a lot. There's a lot of time and effort and pain and emotion and satisfaction and everything else that goes into that. That there's something about pulling it all together to submit that application. Then there's the practice sample review. Then it goes to the board, it gets reviewed, and then the oral exam, and you go through that. It does take some number of months, but at the end, I think it's well worth it. Um, and you know, and you're board certified. So a couple other things. I'm kind of nearing the end here. It's so obvious. Why do we even put this in? It's a lot of details. Doing this is a lot of details. The manual has many details. Follow the instructions. We've tried to make adjustments to the manual to make it as straightforward as possible, because it's not just a linear, just to check, okay, I did this, and there are elements of that, but writing the practice sample, you've got to make sure you're hitting a lot of points and it's cross-referencing the different domains, and you got those 9 questions that take time, to kind of go through that. Um, let's see here, and there's a space limit, so it's not like you got to write 30 pages. It's 12 double space pages. I don't write in double space anymore. People, it's easier to write in single space, so it's 6 single space. In my view, it's a lot, but in some ways it may be harder to make it shorter. It's that old thing that it's harder to be simple than complex, because complex you can just keep adding stuff. Here you really have to be focused and articulate, what it is you want to articulate about yourself and answer the questions. Of course, redact patient information, everything's de-identified. The video, as I said, is a recent. Describe a specific ethical dilemma. And I said, it's not like it's a general thing or something in general happened. It really has to be your own personal experience. I said earlier about the consultation part. I mean, assessment intervention, people either forget or may gloss over it. It's an important part of clinical psychology and needs to be included. And then there's the other option. You don't have to be alone on this. The board can work with you, provide you a mentor. There's a mentee handbook that can be helpful. If you feel like that in some way, it could be a way to hold yourself accountable. It could be a motivator, or just getting some support to go through this process as you're trying to do your full-time job and live your life and family life and everything else. So it's not an easy thing, and a mentor can can be very helpful. Okay, so here's the last part, just in a few minutes. Then we'll have probably 10, 12 minutes for questions. So it's abap.org. You get the home page right here. And here's my, hand circles of submit a new application. And it takes you, another page. Here, steps in applying, so that there are general requirements here, and then there are specialty specific requirements. So the generic requirements, they kind of, it goes together. So generic is for all specialty areas. The specialty are just for, here in this case, clinical psychology, with the instructions. And then it gives you, here are the different specialty boards. There's the clinical. Click on that. The document library. So this is where there are it's the practice sample for the application, the manual, so on. And here, the document library, brochure, manual, the application, other information. There's a video on YouTube. I'm not sure exactly. It's not that long, but it's very informative. I saw it some years ago. I'm not sure exactly how long it is, but I know it's informative and easy. If you're in between something and just want to check it out, you look at it on your phone, for example. And that's it. So, are there any questions? And
So I think some people can type in questions and we can do our best to answer them. And I just responded to Dr. Thompson. It was a question regarding the ratio of completed applications um, compared to applicants who earn board certification. And I don't have that specific information. And something that delays an evaluation of that ratio is because of the early entry option. Some people are students, and it could take several years before they continue the process to pursue board certification. I can say that sometimes there's a question regarding early career psychologists and what's the pass rate for ECPs. And there's a recent article that was published um, that from various people at ABAP that found that ECPs pass at a very similar rate. There wasn't a statistical difference between ECPs and non-ECP applicants, except for neuropsychology, and they found that neuropsychology ECPs pass at a higher rate. So a question is it possible for someone to get board certified in more than one specialty field, such as clinical and geropsychology? If so, how complicated is that process? So yes, so I think the record is 5. So someone has 5 board certifications. So I think it's someone
Oh
that
my
definitely likes
goodness.
it. Yeah, test themselves. Um, I believe it's Nadine Kaslow holds the record.
Oh,
But I could be wrong about that.
I could
But
see
yes,
that.
so some people have clinical and geropsychology. So for example, the trustee of geropsychology, um, uh, Dr. Molinari, is board certified in both clinical and geropsychology. So it's nearly the same amount of work already being board certified. The piece of it that it saves in seeking a second specialty or additional specialties is that you don't have to do the generic credential review because it's already been done. So verification of doctoral degree and postdoc and all that information doesn't have to be done again, but you have to do the specialty credential review to ensure that you have the training and background for whatever particular specialty you're pursuing. You're very welcome. Does the website list the stats for how many people are currently board certified in clinical and other areas? I don't think it's on the website. It is occasionally referenced, I think at least yearly, referenced in the newsletter, The Specialist. You could also do your own search. So board certified psychologists, there's a directory. So you can see how many there are at each specialty. Um, and for clinical, it's about 1,500. Does that sound correct to you, Ed? Yeah.
Yeah, I was thinking 1,000 to 1,500, so I don't have the
Yes.
exact
Yeah.
count, but more than 1,000, less than
Um,
2,000.
how
So
long is
yeah.
application information held onto? I've applied in the past, but been unable to complete due to service being in the Navy. Out now and want to finish. Yes, so it's held on to um, essentially indefinitely. So the application is held on to. What happens is they follow up usually yearly to see if what the progress has been. I think if central office does not hear back, I don't think they discard any information, but they kind of put you in an inactive status. Um, so if it's been many years, I would definitely reach out to central office, and their contact information is on the website to see what materials they still have. You're welcome. And I just want to add a comment. Probably the most common question or concern I get from VA and I think also DoD psychologists is the concern about using USB drives. So in many settings, you're not allowed to use a USB drive, or it might be complicated to use a USB drive. So when we get the online submission portal up ready. Hopefully by the end of the year, and the most recent report indicates maybe as early as October. That would reduce that barrier. However, I speak to my experience with that barrier as I went to medical media or public affairs and asked them how I can record in order to pursue board certification. And depending on the VA setting, depends on their familiarity with the process. So sometimes their medical media department or the public affairs department is very familiar because they've done it before, and they'll give you some guidance. Sometimes you might be the first, or there's only a few. Um, but they essentially gave me the equipment, in my experience, to record onto a cassette. So this was a few years ago, or record onto essentially provide me the camera equipment and record that, and then I returned the camera to the medical media department, and they transferred it to a USB since they have the authority and the equipment to transfer information onto a USB drive. So they just asked me to provide the USB drives, and of course I had to get all the consents and permissions from public affairs and then also from the veterans. So it is possible. I have heard some people have difficulty either reaching out to public or getting responses from public affairs or from the medical media departments, but sometimes they are familiar and they can guide you. Another option is if you can talk to your supervisor or your chiefs. They might have some experience with it, or other people that have board certification in your particular hospital. So I'm 100% telepsychology in the VA, and my sessions can be recorded via our VOD software, I think. Can that be transferred to a USB? I don't know. That's far above my knowledge of technology, so I would reach out to medical media to see if that's a possibility.
Yeah, I agreed. I'm not tech savvy enough to know how that would be done, but it does have to include both you as the therapist
Mhm.
and the patient in the video. So if that is there, I think that
Yeah, I think if both
certainly
camera
meets one of the
angles
major
are
requirements.
recorded, synchronously recorded, I think that would be fine as a submission.
Good question.
Yeah, I think it just parenthetically that with all the boards, like telepsychiatry wasn't, or tele mental health was not part of the picture when, the rules were developed. But now, the world is changing, the digital. So we're doing the best we can to accommodate and modify, as long as we can be consistent with the standards, so that the digital media, like I said, as long as both of you are in it, that makes it, more viable. That makes it viable.
Looks like there's another question coming. And just want to let other people know we've got a few minutes left. So if you have any other questions for Doctors Neuhaus and Caraballo, please put those in the chat box.
So most of the work I do is in Spanish. Would that be acceptable? How would that work? Yeah, that is a challenge. We have received samples in the past that are non-English samples, and it's fairly challenging to put together a committee that feels that they have sufficient competency to conduct that kind of exam. What do you think, Ed?
Agreed. I think if we have on the board side that expertise, that makes it potentially possible. But I think right now it is a challenge. I wish I had a better answer, but. And this, I just want to clarify, this is specific for the video sample, correct?
I I think
Okay, yeah,
Spanish, I
I see
wouldn't
that.
be able to promise that or guarantee that we could do an exam in Spanish. Um, I can think of some examiners, including myself, that could be on that exam committee. Um, I will say that some languages are a little bit more challenging than others. So, for example, we had a submission in Mandarin, and we just didn't have enough examiners available to conduct that exam. So the candidate had to look for an alternative sample in that particular case. How many examiners are on each committee? So three. So three is the standard committee. So the examination committee that does your practice sample review, so the professional statement and the work samples and the videos, or for the senior option, the portfolio, is the same committee that then does the oral examination. And some boards use a station model versus kind of a simultaneous exam where everyone's together. So for clinical psychology, it's the entire committee together with the candidate. For other specialty boards, it's one examiner at a time that covers a particular section of the oral exam. You're welcome.
Right. I think I'll kind of start wrapping things up. And so these are really good questions. And so I want to thank everybody for being with us today, and a special thanks to both Dr. Neuhaus and Dr. Caraballo for informing us about the process. And for those of you who are interested in receiving continuing education credit for participating in this webinar, you may request this by completing the online evaluation by next Tuesday, September 10th. It's in the notes pod, but I'll go ahead and put it here in the chat box. Online evaluation link. So you can take care of that. It shouldn't take more than a minute or two. And so remember, CE is free for Division 18 members and available to non-members if they wish for $15, which can be paid through our PayPal link. And that link is also found in the notes pod. And then will email CE certificates in about 2 to 3 weeks. And I'll also send an email to everybody who registered just to remind you of all of these instructions. And our next webinar takes place on Thursday, October 3rd at 1 o'clock Eastern. It's going to be presented by Dr. Carl Lukefeld from the Federal Bureau of Prisons. The topic will focus on veterans programming in the Bureau of Prisons. So it sounds really interesting. And stay tuned. I don't have the advertisement for the webinar just yet, but I will be sending that out soon so you can register. But do save the date for Thursday, October 3rd at 1 o'clock Eastern for that webinar. And so thanks again, everybody, and have a good one.
Thank you, everyone.